drowsiness which enables
the person to be aware of himself and the surroundings. That's what are the symptoms of disturbed sleep. We talked about sleep and the stages of sleep. So the disturbance of sleep gives symptoms. Maybe hypersomnia, which means increased sleep, or narcolepsy, which is involuntary short bouts of sleep. Somnolence, this is sleep that can awaken from it to normal consciousness. Dizzy, but when it aware, it will be in normal consciousness. What are symptoms of disturbed consciousness? We talked about symptoms of sleep as a normal function. When the sleep as a normal function disturbed, it will give the previous symptoms. But consciousness, when it disturbed, it will give us the following: quantitative changes in form of coma vigil, stupor, confusion, cloud consciousness, torpor, and trance state. Where is Mustafa? He was confusion. He was talking about confusion. And qualitative changes in form of dissociation, dream-like state, restriction of consciousness, somnambulism, and hypnosis. These are quantitative changes, and this is qualitative. This is change in quantity, and this is change in quality. Quantitative change, we talked about it the last time. Coma. This is, you see, this is comatose patient in intensive care unit. Coma vigil, which is open eye coma. Stupor, we talked about it last time. Confusion, we talked about it, and we say that it is present in delirium. Cloud consciousness, torpor, and trance states. And we come back to the qualitative changes, which is dissociation, dream-like state, restriction of consciousness, symbolism, and hypnosis. Dissociation. Some of psychological functions are acted separately, like movement. Usually, the children at age of 8 or 10 years, usually during sleep, will move and go around in aimless movement and come back to the bed again. We call it dissociation in movement. If the change in memory, we call it the dissociation in memory, as we will see in the next. Dream-like state, the lack of consciousness as subjective experience with increased threshold of perception to all stimuli. So all stimuli has increased the threshold to perceive it. With lack of orientation for time and place, but oriented for person. This is dream-like state, lack of consciousness as subjective experience. We said at first that symptoms may be subjective or objective. This is a subjective symptom. This is a subjective experience with increased threshold of perception to all stimuli. So it is lack of consciousness in a form like dream state. Accompanied with visual hallucinations. Visual hallucination is objective symptoms or subjective? It's subjective because the patient tells about these symptoms. So accompanied with visual hallucinations of small animals with fear. With fear. Fear is a feeling, so it is subjective also. Rarely accompanied with auditory or olfactory hallucination. And it is usually associated with temporal lesion. You know that the cerebral cortex is divided into frontal, parietal, occipital, and temporal. So this lesion of temporal will give this symptom. Restriction of consciousness. Patient's mind occupied with few situations and ideas. Is it subjective or objective? Patient's mind occupied with few situations and ideas. Yeah, objective. Because you observing it, but the patient can't tell that his mind occupied with few situations and ideas. But on examining him, he is occupied with these few situations and ideas. He is talking with you about this and the impaired orientation for time and place. So this is objective. Yes, you examine and you observe this symptom. Twilight states. This restriction of consciousness includes twilight state, which is pathological constriction of consciousness that prevent normal consciousness and behavior. So it is pathological. And you will observe it, the twilight state, and it occurs in epilepsy and hysteria. In hysteria, it has unconscious motivation, and it's called the catathemia. And this is a very known symptom in hysteria. And it's important to know that catathemia is some form of disturbance in consciousness, and it has unconscious motivations. Unconscious motivation here is a dynamic psychopathology. You see, it's from unconscious motivation. When you discover that this twilight state, which is pathological constriction behavior and has unconscious motivation, so you will be in the field of dynamic psychopathology because you observed that this symptom is appearing due to unconscious motivations. And you know that we have in hysteria primary gain and secondary gain. So we have unconscious motivation to the primary gain when the consciousness is changing in a hysterical patient with unconscious motivation. So the change of unconsciousness here is the primary gain, and secondary gain which the care and attention which comes from the surroundings and his family. Fugue. It's called wandering, as accompanied with amnesia up to a certain limit. You know this actor? Do you know him? Do you know him? Yes. This is Fadi Muhandis. This series, and he was the hero with يونس شلبي. يونس شلبي كان اسمه حيرم في المسلسل ده، وكان فؤاد المهندس بيقوم ويمشي ويتحرك ويروح ويعمل حاجات ويرجع وهو ايه؟ نسيها تماما. فهو ده بقى اللي ايه؟ الفيوج. wandering accompanied with amnesia up to certain limit. Somnambulism. This is the walking of a child during sleep. Somnambulism. But if it happened in an adult person, it's a symptom. It's a psychiatric symptom. But if it happened in a child, usually we call it as just immature. Just immature control of the brain to the human being, because it's still immature brain. So if it normally happened in children, but in adults, it is pathological and found in schizophrenia or schizoid or epilepsy. And I faced cases with this somnambulism. He was a man working in Al Hussein Hospital, and he presented his young grandson, and he said that he is moving during his sleep and going to the balcony and wanted to go out from the balcony. The father catch him and gave him to me, and I diagnosed it as epilepsy and confirmed it with EEG in lab sleep. In lab sleep, do you know the importance of lab sleep? So when I diagnosed him, I gave him anti-epileptics, and he became very well. Hypnosis is induced change in consciousness in case of suggestion, because hypnosis is a suggestible, a change in consciousness, and it is self-suggestion. If the patient is in a transference relationship with the therapist, and he is in confidence with the therapist, and the therapist gave him suggestion to go in a sleep, just relax, just your eyelids are very heavy and you are going to sleep, relax, leave yourself to go in sleep. So he will be through this suggestion to go in sleep. Breuer and Freud, in their beginnings, they were treating patients with hypnosis, as I told you before. It's not a real sleep. It's a trance state or dissociation. But it is not real sleep, because the changes in EEG through hypnosis, it is just like the waking state. It's not like sleep state. So it is not a sleep. And it is the trance state or dissociation, and the EEG is just like the waking state. we can summarize what we have said in consciousness disturbance into symptoms, quantitative changes, coma and coma, vigil, stupor, confusion, cloud consciousness, torpor and trance state, and in qualitative changes, it is dissociation, dream-like state, restriction.